You mentioned there's a few thousand people on watch for isolation or potential contact. Do these people get tested, or are they kind of in limbo? Are their lives in limbo for 2 weeks, or is there any point at which they can get tested even if they don't have a symptom?
So yes, their lives are in limbo, and this is what we're trying to say. This is why it is so important for us to be aware of large events where we can have this type of exposure where many people might be involved, or we pass this virus on to the people we are closest to, the people we spend time with. In a face-to-face environment. We know that it's mostly spread when we're close to somebody and we're talking or laughing or singing. So those are the situations we need to be more careful about. And when somebody's been exposed, there's nothing we can do to stop them from getting infected if they've inhaled enough dose of the virus. We just need to wait that period of time, which is up to 14 days, to see if they get sick with it. Most people get sick around day 5 to day 7, so even if they have very mild symptoms, they will need to be tested within that period of time. If they make it to 14 days without having any symptoms at all, then there's no need to be tested. And the situations, though, can be, it's not black and white as with everything. So if it's a cluster in a long-term care home, for example, we know that elderly people can get it very quickly, that we may have transmission that we haven't recognized. So we generally will test everybody at the beginning and then wait out the period of time. So there is some nuance if public health deems it important as part of their investigation to understand, and those are mostly higher risk settings where people are living together. So in a household or a communal living setting like a long-term care home, or we saw this with our temporary foreign workers where we had an outbreak and it was important to assess everybody, people in the correctional facilities. So there are situations where people will get tested, but having a negative test in the incubation period doesn't mean you're home free. It means you still need to wait that incubation period to make sure that you're not still developing virus that's going to be able to infect others.